This is Akash, our second author of the study. The study topic is a holistic cognitive rehabilitation approach for traumatic brain injury, a single case study. The study includes an introduction where traumatic brain injury is an acquired insult to the brain from an external mechanical force that may result in temporary or permanent impairment, where holistic neuropsychological rehabilitation aims to improve clients' self-awareness, elevating cognitive and emotional deficit along with vocational outcome and increasing interpersonal skill. In overall neuropsychological rehabilitation, EEG training and cognitive retraining plays a very vital role in that. The objective of the study is to understand the effect of holistic cognitive rehabilitation on cognitive functioning, symptom reporting, and quality of life in patients with TBI. The method we utilize a single case study design. Procedure includes a baseline assessment, following with intervention, and following with post-assessment. The case detail includes a 22-year-old female, postgraduate, predominantly high functioning, presented with a history of head injury illegally due to fall while playing, leading to loss of consciousness for 2 days. MRI finding indicate mild subarachnoid hemorrhage in right frontoparietal temporal region with subdural hematoma in left parieto-temporal region. She was referred for neuropsychological assessment and rehabilitation in November 2022 in view of her cognitive deficit, emotional changes, and decreased grades in her academic. The finding reveals impairment in executive functioning, learning, memory in both verbal and visual modality, along with low mood, irritability, and lack of motivation. From here, our first author, Athili, will proceed.
The holistic cognitive rehabilitation involves 4 phases: psychoeducation, vocational counseling, neurofeedback training, cognitive retraining. The EEG neurofeedback training was aimed to optimize the thalamocortical loop to improve executive functioning such as attention and general arousal level. It was based on alpha theta protocol, where active site was placed at O1 and the reference and ground was placed at A1 and A2. Total number of sessions was 15, 3 days a week for a period of 2 weeks. Prior to NFT, subject was instructed to do slow and regular abdominal breathing. Cognitive retraining module was also based on the principle of restoration, adapted from Dr. Chaubeny, home-based CR. The tasks involved was shedding, passat, grand sorting tasks, category and phonemic fluency, temporal and spatial encoding. Total session was 20 sessions, 3 days a week for a period of 2 months. And after a period of 2 months, the holistic cognitive rehabilitation, the findings indicate significant improvement in the areas of cognitive flexibility, sustained attention, and verbal working memory, planning, learning and memory in both verbal and visual modality, along with significant improvement in quality of life, particularly in psychological domain, and with overall reduced perceived stress. However, on RiverMed, post-concussion symptoms was increased due to improved self-awareness, which could indicate better neuropsychological outcomes. And discussion and conclusion, this present study investigated the effects of holistic cognitive rehabilitation on cognitive function, symptom reporting, and quality of life in patients with TBI. Consistent with previous research findings, current study reveals significant improvement on executive functioning, learning and memory, as well as overall improvement in quality of life. In conclusion, the study demonstrated that holistic cognitive rehabilitation via psychoeducation, vocational counseling, EEG neurofeedback training, and cognitive retraining is effective in improving self-awareness, cognition, emotion, and psychosocial functioning. However, further research is required to address neurocognitive deficits in low-middle income countries with its cultural diversity and limited resource. In future, cognitive behavior therapy and structural vocational rehabilitation could improve overall outcomes in moderate to severe deep traumatic brain injury. Thank you.
Thank you.